So, as you've heard, my name is Dr. Jemimah Kariuki. I am a resident in obstetrics and gynecology, doing my part 2 at the University of Nairobi. And my presentation today is on maternal health, and I'd like to present Wills for Life, a solution for the problems seen because of lack of access due to COVID-19. So meet Pamela. Pamela is a lady who in 2020 decided to buy a razor blade and go to her neighbor so that the neighbor could help her deliver from the house, because one, she couldn't afford to get to hospital, and two, even if she could afford, this was happening at night and there was no public transport available. Luckily for Pamela, she was able to reach us and we were able to take her to hospital safely and deliver that bouncing baby girl that you see in her arms. On the other side, and with our pictures, we have Sophia, a lady who started bleeding from home at around 11 p.m. at night and was alone. And she bled alone all through the night. And she was found by her neighbor early in the morning. And that's when they called us. And by the time we got her to hospital, unfortunately, we lost her. So in Kenya, we have 360 a mortality ratio of 362 per 100,000 lives. Per 100,000 lives. It is recorded that only 62% of all deliveries are attended by skilled health personnel, and 60% is either due to lack of transport, lack of funds, or the long distance to travel in hospitals. Now, to give you a bit of hindsight, in Kenya we have the third wave currently, and a recent ban that was put by the President of the Republic about 4 days ago. Before that, in the first wave, we had put in place around the 7th of April 2020. And what resulted from that is that there was no movement from 7 p.m. to around 5 a.m. Every day. And there was no public transport that was allowed on the road. And the only people who are allowed or were found necessary to be there were listed in an emergency list that all the police officers had. This meant that anyone who was not in that emergency list was not reach any other destination. And as we all know, pregnancy does not wait for COVID or for curfew times to be over. Deliveries will still happen. And therefore, with the very many complications early in the morning, as was the case with Sophia. And that's how Wills for Life was birthed. So I will give us a few minutes to be able to get to see or experience Wills for Life as a video, so that you can journey with us before I continue speaking.
The Wills for Life initiative came about as one doctor called Dr. Jemimah Kariuki, who is a resident or who is studying for obstetrics and gynecology as a master's and at the University of Nairobi, and she took her own initiative to put her number out there in social media platforms, so that any woman who needed access to go to a facility was able to call her number and she would facilitate using her own resources.
Wills for Life actually started from a tweet. Once I noted all these discrepancies in terms of maternal health care, I went online and I tweeted, whoever needs any help would just call me. And initially I didn't have a master plan, but God opened his doors and here we are. So the uptake of that particular tweet was quite phenomenal, because in a matter of about 12 to 14 hours, there's so many retweets.
So she approached us as Kenya Healthcare Federation and was seeking support in terms of partnership and how to make it more sustainable. So as Kenya Healthcare Federation, we put together some of the partners that we work with. Bolt is a transport company that willingly stepped on board and said, look, we are here. We are able to offer 500 rides in the initial phase. We got into a partnership with rescue.co, who are a platform that mobilizes ambulances all over. We linked up with the county government of Nairobi Metropolitan Services, that were also looking at improving the access to care for the expectant women within their county. And we also linked up with Telesky, who are the call center provider. And the number that we were given under the Kenya Private Sector Alliance Partnership was 1196.
Venye nimesaidika hivi, hata mi siku moja nitapatia mama mjamzito hii namba, na wapigie au simu na wamsaidie, na nitawaelezea au mama wajawazito kama wenye walikuwa wajawazito kama mimi. Hiyo namba wakipiga watasaidika, na si ati ni watu wa uongo, ni watu wa ukweli kabisa, na wamenisaidia na nimeona na macho, na si ati ni kitu yenye nimeambiwa.
So we are looking at a future where each and every expectant mother will have access to a facility, and so the delay will not be because they did not have the means to get there. We are seeking for partners. If you're interested in supporting the initiative, you can reach out to us through email, that is willsforlife@khf.co.ke, or even call the 1196 if you forget the email address. We'll be able to get you in touch with one of the partners who will have that conversation with you. But our overall goal is to uphold the initiative that says no woman should die giving life. So since then we have delivered over 350 babies, and we are very happy that these babies have been able to access care because of the initiative of the partners who've come on board. And we do share our appreciation to everyone who's been pulling their weight to ensure that no woman dies while giving life.
Okay. So thank you so much. I believe you've seen what we are about. And I just want to take us briefly through the process. It's rather easy. Where a lady at home is experiencing perhaps labor pains, and they call a number that doesn't even require internet, and they call our call line, which is the 1196. From there, the call is picked up at the call center, and at the call center, it's redirected to our doctors, and our doctors are able to listen and triage, and if it's just a consultation, give a consultation. If they require advice or dispatch to hospital, they'll send either a car or an ambulance to make sure that this lady gets to the right level of care. And after that, the lady is told, and from there is able to deliver safely to a child who we believe will go back to impact the society in one way or another. And that's the Wills for Life process simplified. So our goals is to make sure that we are able to return morbidity and mortality, especially during the COVID-19 pandemic and beyond that, because we realize that access to care has actually been an issue that has been masked for long. Because even during the day, we're still getting calls of women who are unable to get to hospital because it's either too far or they just can't afford it. And this is why we would like to keep on working and achieve objectives. Our objectives are simply to follow the guidelines set up by the World Health Organization and the obstetric RCOG, as well as the guidelines. We'd like to make sure that we triage our women to get to the right level of care, such that if it's anticipated as safe delivery, they can go to level 3, level 4 care. If we anticipate that they're going to need a CS, then we also guide that. Then we also make sure that we accumulate data that can be used to inform policy, that we get them transport, that we get them transport to the right level of care, and then that we form partnerships that are long lasting to ensure that this continues, that we create awareness to the population so that they know what to do in case they have any emergency, and beyond that, what constitutes an emergency. I'm having an issue with my connectivity. I hope you can still see me. So in the last 8 months of operations, we've been able to, sorry about that. In the last 9 months of operation, we've been able to help 97,744 women through inquiries and charges. We've been able to give teleconsultation to 4,192 women. We've been able to dispatch 945 cabs and 750 ambulances through the partnerships that you see below in that poster. So we'd like to really thank our partners for the support. But beyond that, we'd like to say that we still have a lot of work to go. We have very many women we need to take care of. We have very many women we have to take care of. And beyond that, we have children that we need to reach in terms of help. So if you're willing to partner with us, do reach out so that we can actually gain more, help more women and guide more women so that they can get skilled health delivery. And this is the vision of Wills for Life, that no woman should die while giving life, and no woman should walk through their pregnancy journey alone, because it's difficult enough as it is. So thank you so much, and thank you for having me at Wired Health.